Good afternoon. Good morning, everyone. I'm Sandra Whitehead. I'm the current president of SOPHIA. I'd love to welcome you to our webinar today. If you are not familiar with SOPHIA, if this is your first time with us, welcome. We are the Society of Practitioners of HIA that evolved into the Society of Practitioners of HIAP. So we call ourselves the HIAP practitioners, and we are so happy that you've joined us today. And today we are very lucky to have Michael Chang with us. He is an associate town planner and healthy planning lead at NHS Property Services in the UK. And he's currently pursuing his PhD at the University of Bristol. From launching the Reuniting Health with Planning initiative to co-founding the Health and Wellbeing and Planning Network, Michael has been at the intersection of health and planning for years. And I'm so excited to welcome him. He is an author and a thought leader in this area, not just in the UK, but internationally. I actually met Michael when he invited me to join a workshop with him at the American Planning Association a few years ago. Thank you so much for joining us, Michael. We're happy to have you.
Thank you, Sandra, for the very generous introduction. It was only actually last year when we were at the APA conference, so not too long ago.
It seems like a longer than that.
It does, it does. I'll just share my screen. Can you see that? Okay, thank you very much. So thank you, everyone. Good morning, good afternoon, wherever you are in the world. I'm currently joining from Ireland, and obviously I'm from the UK. So a bit about my background before I go into today's presentation, and I'll really welcome any thoughts and comments throughout my presentation as well. As Sandra said, I'm currently working as well as having doing a part-time PhD, and actually a lot of my work around health impact assessments in the urban planning field had been in my previous job role rather than current job role. So previously I was in the Office for Health Improvement and Disparities in the Government Department for Health and Social Care, where I led the Planning and Health Program. A lot of the HIA work was happening then. So today, my presentation is very much based around the learning and the work at that point in time, but obviously trying to make it more relevant as well internationally and to the American audience, as well as just draw on examples here from UK and England. So the structure of my session, and again, I am not going to go into the health impact assessment process and theory and concepts and approaches a lot. There's actually only one slide on that because I do assume that you can either access resources that can explain that better than me, or you have some knowledge already on HIAs. The primary focus today is really about the use and the relevance of the use of HIAs in the urban planning kind of sector. So I will be going through potentially exploring the HIA roles in the ecosystem of the HIA, assessing health in plans and policies, how to create an HIA policy in your plans, assessing health of projects, and then reviewing quality assuring completed HIAs, and then concluding with a bit of a talk about capability, skills, and training needs. And that's the structure of my talk today. So really, my only slide about an HIA is really testing and reflecting on what is a health impact assessment. Is it a way of thinking? Is it a process? Or is it an assessment? And actually, if you refer back to the WHO definition, which we all know, very well, it's a combination of procedures, methods, and tools. So therefore, it is really a combination of all the above. It's a way of doing things, it's a process, and then it's also a document or an assessment that you produce at the end of the whole process. And we should see it in that kind of way, rather than just as a thing that you do wherever you are in the urban planning stage, but actually it's how you approach the issues as well. Again, I think the main thing to emphasize on the HIA is that it does potentially three things around health and well-being. It helps to reduce the negative impacts of poor health, such as air pollution, noise pollution, those health protection issues. It helps to improve well-being. So how do you go beyond the baseline of, say, an air quality standard and say you improve the well-being, the mental health of the community? And then thirdly, to help reduce health inequalities or health equity, however you use the term, across our communities. And again, there are different types of HIAs: desktop, rapid, comprehensive, and then the different scope of HIAs, prospective, concurrent, and retrospective, and all this you can pick up on SOPHIA literature, which I won't go into. But I think understanding the different things that you could do within an HIA, the different approaches within the HIA is really quite important, because you can use them as and when you need the different types and scope. So there isn't one HIA, there are different HIA approaches that you can employ at different times, and I'll go through that in my presentation. So really, I think this is just about the things that you can look for. And this is from a document that I worked on back in 2019 here in England. We had produced a document called Health Impact Assessment and Spatial Planning, a guide for local governments. And we produced some guidance to look at the range of issues that you could look for around the kind of building blocks for health, that looks at around a lot of the health issues that you may want to address, and the environmental determinants that you may want to look at from neighborhood design, nature, crime, safety, healthy food, climate change, and everything else that you know around the determinants of health. Again, I won't go through this in great detail because I think we understand these issues, and I'll go through exactly how we think about these in the urban planning sector. So really, I think the HIA process is quite straightforward, and I added something in there. It's step 7, but if you begin from step 1, this is obviously not a kind of a linear process. It's very circular, and some things come up to the fore at different points in time. But there's step 1 screening, where you decide whether policy or projects will have impact and therefore it warrants an HIA. You go through scoping, looking at the issues you may want to look at and assess in your HIA. You do the actual assessment and different methodologies to look at the conditions and the health issues there. You make recommendations. How do you improve the health or protect health? And hopefully you feed this into the proposal for the policy or the project concurrently, rather than at the end of the whole process. You report them into a document or template as advised by your authority or best practice. You monitor and you track the impacts if you can, and then finally you review and you assure the completed HIAs. And actually, step 7 review and quality assurance, I'll go through this later on, can be at the beginning of this process rather than at the end as well. And all the guidance you may find internationally from the WHO, SOPHIA, or in your respective nations will provide guidance on these stages. So I won't go through this in great detail. But the key thing that I do get asked a lot by local government and developers and consultants and others who are really just on the fence in terms of why do we need an HIA? I need to kind of figure out what's the evidence and literature saying around the benefits and value of having the HIA being done or promoting the use of HIAs. We all know that firstly, it does identify health impacts in a more systematic way. It brings health to the fore of decision-making rather than, to the back, or you don't think about it, proactively. It generates evidence-based recommendations, enable decisions to be based on health, wellbeing, equity outcomes rather than purely economic. So you can make decisions on air quality, for example, and transportation on non-health issues. But obviously an HIA allows you to think about those issues from the health perspective. An HIA process can actually help reframe quite contentious developments. And we have issues, say, around shale gas and quite major developments that an HIA process can help manage those risks and issues. You can help achieve better collaboration between public health and local urban planning teams or departments. But it is really quite difficult, from literature at least, to isolate a particular element of developments to the use of an HIA, because HIAs often done concurrently or to inform a proposal. Therefore, it's really quite hard to demonstrate by doing X or an HIA, it can lead to Y. And that is the issue that we face in articulating the benefits of an HIA. But at the same time, though, we can use case studies to say, in general, the HIA has contributed to these outcomes. And I'll go through one example with you later on. And then I get asked the question, well, an HIA obviously is an assessment, it's a process, it's going to cost some money. How much does it actually cost? And it may vary across the countries, but from a research done a few years ago by the Department of Health here, it can range from £5,000 to £30,000, depending on the scale, and that's pretty obvious. At a smaller scale, rapid desktop HIA may just be quite cheap and straightforward versus a comprehensive one that you need to engage the communities and others for a very complex project. So it depends on the scale, but there will be a cost element to it. Nothing's done for free. Time also should be costed into that rather than just the consultant's time. And therefore, we had to be very mindful that by advocating and promoting the use of HIAs, at some point, someone has to pay for it somehow. So I think in my presentation, I'll go through an HIA, and I think in some ways people think of an HIA as of being done to a project or of a project. But actually, when I was doing some guidance a few years ago, I found that there's potentially a gap in guidance on HIAs, and I'll go through in a second. But there are four things I want to go through. Firstly, you can do an HIA obviously as part of a project assessment as a standalone HIA. You can do an HIA of a plan or policy as you do them. But also in some parts of the UK, we do try and promote integrated assessment. So you may do an environmental assessment or health equity assessment. Actually, an HIA could be done as part of that package of assessments rather than doing 4 separate assessments. You do one, and there are good examples here in the UK, and I'm not sure whether in America you have those examples there as well. I think, I keep saying to people involved in the HIAs, whether you're from local governments, consultants, academia, the community, firstly, you had to figure out your role in the HI ecosystem. Even though we present HI as a very linear process, screening, scoping, assessing, reporting, etc., the ecosystem is quite complex. And if you try to map out and understand your role in the system, in the process, that makes it easier for you to not be too bothered about other things that you have no control over. So this example here is something that I did fairly quickly for this particular presentation to say, if you're doing an HI of a plan, what is the HI ecosystem? You have the HI stage on the left, and that's always going to be the same. Nothing's going to deviate from there. But different involvements, whether you're a town planner, urban planner in the local government, or whatever authority, whether you're a health practitioner, whether you're the community, the HI consultant, or the developer, you all have different roles in the system. So very, very briefly, and your situation may be different, and this is how I articulate my particular example. So if you're doing a plan, an HI of an emerging, urban plan or a policy that's done by the public authority, then potentially as an urban planner, you have a lot more, scope to be involved in the scoping process of looking at what issues to look at. You may be involved in doing the assessment of the HIA, or even be involved in monitoring the HIAs. Health professionals, I think, should play a greater role in everything around the HIAs. They may lack capacity, and capacity is something that I'll come back to. But if the health team is lacking capacity and they don't want to take a lead, or they're not willing to take a lead, or they're not able to take a lead, then actually the HIA may fail as an effective process. But they may want to be, and they should be involved in most of the HIA process. In this particular example, I'm assuming that the HIA of the plan is done within the public authority. It's not commissioned out to the private sector to do. A lot of the HIA is done in the UK example, for instance, they're done in-house by the public authority. They're not commissioned out. Therefore, the planners and health professionals have a lot more control and have a lot more involvement in the process. Again, it may be different in your example where you may commission out the HI of a plan and policy. Then actually the heart will shift towards the HI consultants. But regardless, I think health professionals and planners will have a really important role in the earlier stage of the HIA in the screening and scoping process, and you leave the assessment to the people doing the actual assessments. If you're doing an HI of a project, again, it's a completely different ecosystem. If you think about a housing development coming forward, a transport project coming forward, a waste project coming forward, an infrastructure project coming forward, then actually the kind of control is more within the developers who are bringing forward that development. So again, that shifts the balance, because again, the assumption here is that the HIAs is actually not done within the public authority. It's done by the private sector when they bring forward a proposal development. So therefore, the HI consultant comes in and has but more of a role. But regardless, if you look at screening, for example, the developer obviously firstly has to think about, okay, do we need to do an HIA? Is there a requirement to do an HIA? Are we required to do an HIA and submit as part of the application, or the consent application? And then the scoping is where the public authority and communities and developers come in together and say, well, actually, these are the issues we want you to prioritize and scope into the HIA. And then the HI consultants can do their jobs and do the assessments and make recommendations and do the reporting, things like that. And you will see different roles there for different people around the quality assurance stage. What you could do, I actually can't see my screen because of the chat, because of the webinar program. But if you see the reviewing and the reviewing stage, the health professionals have a job in reviewing the HIA once that's been submitted. And the developer has a role to review the HIAs actually in a different way. Reviewing means actually maybe at the beginning of the HIA process, they look at the review criteria from the health authority or the planning authority and say, this is what you expect from us in terms of a good quality HIA. And therefore, we review our HIAs internally. So when I get to you, to the health professional, to the planning authority, then it's the good quality that you expect. So that's why I took the reviewing box for the developer rather than nothing at all, because they had to be very aware of that. And actually, you could say the HI consultants need to be aware of reviewing as well. So again, that's my interpretation of the ecosystem for my example. It may be different for you. I think the overall point about these two slides is that you need to figure out where your role is. If you're a planner, then your role is pretty much just limited to those things, and you don't really have to worry about everything else that's not within your area of control, because you don't want to become the ecosystem. You just do your job within that system. So I'll give you one example in terms of health assessments of plans here in England, at least. In my research, actually an HIA, a standalone HIA of a policy, urban policy, is quite rare. So you can see that only 19% of the 350 odd planning authorities here in England have been subject to a standalone HIA. Because in the UK, we are required to do an environmental assessment, and within the environmental assessment, there's a need to look at health issues in there. So in many cases, most authorities feel like the HIA could be embedded as part of that assessment, or embedded as part of the integrated assessments that they have to do across everything else around equality impact assessments and things like that. But regardless, a standalone HIA is quite rare, 19%. And that's not necessarily a bad thing, because if health is looked at and embedded into the environmental assessments, then that actually should be addressing all the health issues we're looking at in HIA. And there are examples and guidance out there. So the good example is look at the Welsh HIA support unit guidance. They produced guidance previously looking at how to do an HIA of a plan or of a policy. You can go through that in great detail, and they produce really quite good guidance. And I'm giving you information here on examples of other councils here in the UK. They have done a standalone HIAs of their emerging plans. You can see the majority of them are done on a draft plan rather than a completed plan, because that allows them to inform the final plan as they adopt that final plan. So the other issue is, so there's a HIA of plan, emerging plan. And actually, I think in America and many other kind of countries across, Europe and, and other countries, an HI is not actually a requirement to do. It's not a policy requirement. It's not a legislative requirement. And in the UK, or at least in England, it's not a requirement to do an HIA. In Wales, they do require public bodies to do an HIA, and they would include local planning authorities. But in general, across the UK nations, apart from Wales, there is no requirement to do an HIA. But when councils want to bring forward an HIA, when local government bodies want to bring forward an HIA, how do they bring forward an HIA? I get asked a question before: do we just make a threshold up? How do we draft the HIA policy? And therefore, our document that I worked on back in 2019 with Public Health England was looking at advising local governments about bringing forward a sound HI policy in their spatial plans. The overall aim is to help increase the coverage and improve the use of HIAs in the planning system in the absence of a regulatory and policy requirement. So again, it's all based on goodwill rather than must do. And therefore, we have to make the guidance fairly easy to adopt and apply by local governments. This document here, you can refer to it another time. It provides guidance to support the adoption of planning policies and guidance on the use of HIAs. Helps you consider whether an HI is required and what the trigger points should be. A trigger point means that at what scale of development would you require the planning applicant to do an HIA? Is it a large scale housing development or 1 or 2 housing units? And that is all dependent on local context. And then finally, how would you align NHIA with all the other assessments that a local public authority will have to do, or the private sector will have to do when they apply for planning permission? What it does not provide is guidance on how to do an assessment. Like I said at the very beginning of my presentation, there's plenty of guidance from the WHO, SOPHIA, and others on how to do an assessment. This guidance is very much about how to make an HI work in the planning process than anything else. So we took the guidance through these kind of 4 stages, ending with the 5 trigger points. So firstly, and this is quite straightforward, and I think we all recognize quite a evidence-informed process here. But firstly, you need to identify the local health needs and evidence, and that is informed by anything that the local health authority has produced in terms of the health needs of that local area. The second thing, you look at identifying population characteristics. So think about the population groups that may be at greater risk of development or anything else like that in your local area. A spatial plan normally plans 15 to 20 years ahead, and therefore you know where the big housing growth regeneration schemes may be or big transport projects may be, and therefore you can potentially identify where and which groups may be at greater risk of from development. From health issues. Thirdly, identify a significance of the kind of health impact happening on that population or those population groups. Identify the likelihood of those impacts happening. So if you have a transport project or housing project that's in the middle of nowhere, for example, then obviously certain population groups will not be impacted on by that development, and therefore the likelihood is pretty much unlikely, and therefore you don't assess that. So once you've gone through that whole process, you should be able to determine what is the most likely trigger point for requiring an HIA. And obviously you need to moderate this with the scale of development that you may have in your local authority area. So think about those issues as well. So I think determining local triggers is really quite key, because you may not need an HI for everything or every development, but for some key developments that are coming forward, the population groups that you may have, then you think about those key trigger points. So I'll give you one example of different things happening. So in England, only about a third of planning authorities here have an HI policy, and I'll go through trigger points example with you in the next slide. And the trigger points would normally be articulated in the main policy document rather than separate guidance. But in many situations, they do provide separate guidance to provide further details, as you can see those 2 examples there in Greater Cambridgeshire and other areas as well. So example trigger points, I think, and I don't know whether Sophia and others have done very similar things in terms of providing guidance on what scale development requires an HIA. but these are from local government here in England. And we did some research into what trigger points they have, and actually they all vary. The key most common one is major. So in the UK, we define major developments as 10 plus housing units. That's a legal planning definition. But there are many interpretation of major and HI policies. And you can see there, some may say more than 50 homes only. So it's not 10 homes or more. It's only 50 homes or more urban development that you trigger an HIA. Some specify 100 homes or more. So and some specify 150 homes or more. So it all depends on their local government area and on the scale of development that they may experience over the next 10, 15 years, that they trigger these, these kind of policy wordings. And you can see they can also target quite specific non-residential developments. So some takeaways as in fast food outlets. Some authorities here require fast food outlets require an HIA, for example. And then some may require a betting shop, a gambling shop, a payday loan shop to produce an HIA, and some may require, say, healthcare facility or educational facility to do an HIA. So really all depends. And I think the criticism is that, at least for England, if you have 330 planning authorities having their own different trigger points, if you are a developer, planning applicant, going from one authority to another, your trigger points is different, and your guidance on HI approach may be different. And I think we recognize that variety may not be useful in some ways, but I think at the point in time when I was working in the department, we didn't feel it was right to specify a national trigger point, because a housing development in a countryside area will be very different to a housing development in an urban area, and therefore we cannot say 100 homes, because in some areas they only experience about 10, 20 home developments, here and there, rather than 100 home developments. So I think it's really down to you to determine how best you trigger your HIAs for your private sector consultants. But I think the whole point, going back to previous two slides, is the process of identifying the trigger points. There has to be evidence driven, based on health needs in the population that you want to help. And then you can moderate this against capacity issues, because in some ways, if you set your trigger points too low, whether they're only 10 plus units, you may get thousands of applications every single year, and you just can't resource that. If you can't resource it, there's not implementable policy, it's not deliverable policy, then why have it? Set the threshold higher. So therefore, you have to moderate your trigger points on capacity. So our guidance take you through that process. So have a look at that guidance if you want to. So here's an example of a policy wording that one or two local authorities here have. Now I want to emphasize some of the key wording here. So the blue one is where that's their trigger points for Liverpool and for Huntingdonshire in Cambridgeshire here in England. Their trigger points is one is strategic importance developments for Liverpool City region, and the other one's a large scale major developments, undefined. But major, as I said earlier, major is 10 plus. But then if you put large scale, then it has to be more than 10. But that's defined in the glossary, as I said. But in the yellow wording is where I think it's where an HI adds value. So rather than just say an HI is an assessment at the end of the process of a master plan or proposal, is done earlier, so it helps inform. So you can see in Huntingdonshire, they said the HIA, you have to demonstrate when you apply for consent that the scheme has been informed by the conclusions of the HIA. It doesn't just say the scheme has been accompanied by an HIA completed, it has to show that's been informed by the HIA. So I think that makes it a lot more effective, rather than to say do a checklist HIA and that's done, but actually you have to demonstrate how the HIA has informed your development. And I would encourage you, when you do your HIA policies, when you drop your HIA policies, that you word it in a similar way, that the HIA is informing the project, rather than just as an assessment checklist towards the end of that development process. So here's what some of the we produced in the guidance about screening whether an HI is needed. So if a local authority does not have an HI policy and trigger points, and then so how would you how would you encourage, if you like, the applicants to do an HIA? Bear in mind that, again, there's no policy requirement here by the local authority. There's no policy requirement at the national level. Therefore, you kind of have to go through quite a process of screening. And this process helps you screen, whether an HIA will be needed, whether it's a standalone HIA or whether it's part of the environmental impact assessment. Again, all that guidance is in the document. And here's another template that I currently try to produce for my work here to say, well, if looking at a project, maybe you do a screening and see whether a standalone HIA is required. And you can do your own screening templates if you have them. Many councils do have their own internal screening templates, and I managed to find one or two. Again, you may have different approaches to screening if you do not have an HIA policy currently adopted into a policy document. Here's one example of an HIA. So something that we did research a few years ago, because we, again, if you remember my earlier slide around the value and benefits of an HIA, we were asked a question or questions, is an HIA beneficial, is it valuable? So we commissioned University of Liverpool to do 2 case study research, and it's published in BMC Public Health. You can click on the link after the webinar. This one is a marsh swamp, a regeneration project in Luton Council in the east of England here. And there was another project in the southwest of England looking at a large-scale developments. So in this particular case in Luton, at that point in time, the council did not have a policy on HIA, nor guidance on HIA. So therefore, they did not have a policy context, but they do feel like they want to do an HIA because of the scale of regeneration. The HIA was comprehensive, it was prospective, so it was obviously early on in the process rather than towards the end. And the HIA was led by an external commissioned consultant. The steering group was made up of internal colleagues as well as a community of the area. And then the findings were, they were mostly process outcomes, but I think the researcher found some potential associations with positive health outcomes as well. But basically, one of the key outcomes of that was about clarifying responsibilities for implementing the HIA recommendations, and you can find all the details in the case study there. But in general, this was a good example of an HIA that was done with good process-related outcomes. So the other kind of thing is looking at reviewing quality assuring complete HIAs. We're increasingly being asked by planning authorities, planners, and consultants. So, okay, we do an HIA, we paid for one, we're requiring one. What happens to it afterwards? Does it go into a black hole? Who looks at it? Is it the health professional? Is it whoever's looking at it? So firstly, there are 2 frameworks out there that we have in the UK. One is done by the Wales HIA support units on HIAs in general, and another one is done by Ben Cave Associates, a few years old now, but that one's very specific to urban development projects. Basically, these are designed to assess the quality of the HIA submitted to the authority in relation to development projects. The Wales one is more general, but in general, you could adapt the Wales one to a development project if you want to. The Welsh one had 6 sections for review with 25 criteria, and then the Ben Cave Associates one has 4 areas for review, 12 categories and 36 subcategories. The Wales one takes a grading approach. It's either good, requires strengthening, or inadequate. And the Ben Cave one is graded by A to D or not applicable. I think the few key things to note in terms of quality assurance. Again, I don't know whether a quality assurance review in HIAs is standard practice or there's guidance from SOPHIA and others around this. It's definitely something that's not common and it's emerging. But anyway, regardless, these quality assurance frameworks exist for the UK. The use of them does assume the person reviewing or examining the complete HIA has a good level of public health and HIA knowledge. It does quite usefully have a matrix. They have matrix for recording qualitative responses and a summary of scoring there. Overall, though, it is very downstream. If you're scoring an HIA by D or inadequate, that is obviously not great because the HIA has already been submitted to the authority as part of the consent application. So what can you do about it? You can either go back to the applicant and say, bad HIA, we do it, but then the scheme is already been designed. So it's very much downstream. So you do want to front load the quality assurance upstream. So one thing that we do try and advise and actually suggest to planning authorities that choose a framework of assurance that you are comfortable with. You can either use one of these two other ones you may be aware of. Include the expectation in your policy or guidance and say, when you do an HIA, we expect you to do a quality assurance based on, say, the Welsh example or the Bencave example. And therefore, when the applicant or the HIA consultant does the HIA, they have this in mind when they do the HIA. So when they submit the HIA towards the end and it's been graded or assessed or reviewed, it's hopefully meeting all the criteria than not. So I think there's something to look for. That's why I said the review and quality assurance stage in the HIA process could be actually step 1 rather than step 7. But again, I think there's something that's very much still not the mainstream here on quality and reviewing. One final thing to add on quality reviewing is looking at capacity, who actually looks at the HIAs, because if you think about the planning process, a planning applicant submits a planning application for consent for housing development. The planning authority receives the application, and then what happens to the HIA? Is it passed on to the health department, or is it kept within the planning team to assess? If it's kept within the planning team to assess, then the planners will have to be trained on an HIA, or trained in this case public health, and how to use the quality assurance. And in my experience here, the majority just don't have the bandwidth or even have the kind of scope of within the job titles to think about, quality assuring HIAs. And then the job falls to public health professionals. If the health team does not have the capacity to look at all the HIAs coming in, then the planners will be thinking, well, why are you requiring us to do an HIA in the first instance? So therefore, that's why I said when you set your HIA policy, set the HIA threshold. When you receive the HIAs, think about capacity and who actually looks at the final HIAs and what do you do with it. So that comes to capacity and capability as well. I think something that I increasingly find in the HIA journey is that actually HIA may seem quite a defined public health tool or lever to use in the planning process, but the implications of improving and increasing its use is so profound across other areas of the planning for health agenda that you can't really, separate out HIA with a wider planning for health work, because if you have no one in the authority looking at HIAs, or they're not trained or qualified to look in HIAs, then really there's really no point asking for an HIA to be completed. It's just something that's not tick a box. So in local governments here, at least in England, they are emerging, actually like Tennessee, like John Vick a few weeks ago in the SOPHIA webinar, he has healthy development coordinators across his county. Similarly, in England, we now have a lot more authorities now recruiting quite similar posts, actually, to what John has in Tennessee. You can see some of the posts there. And part of their jobs will be to look at HIAs submitted and received by the authority and see whether they're good quality or not. But then again, they need skill and upskilling and training. And training is something that's not readily provided here in England on HIA. So again, regardless, look at your capacity and capability, whether you can increase that through these particular posts. And there has been health evaluations of these posts, 1 or 2 of these posts, that have found them to be quite beneficial in terms of process-related outcomes. So to kind of finish on my presentation, a few things to add. I think it's really important that we recognize the challenges and opportunities of HIAs in terms of knowledge, where they exist. An HIA, as I came into HIAs, only about 15 years ago. So unlike some of the practitioners here in the call, I haven't been immersed in HIAs for the whole of my working career. But when I was trying to advocate increasing the use of HIAs, I had to kind of look at the literature to see what the literature says around the challenges and things like that. One of the things around training, we commissioned training back in 2019-20 across UK practitioners, think about what the challenges are in terms of improving their involvement in the HIA world. You can see those bullet points on challenges. Firstly, they don't know how to quantify or qualify challenge health impacts in the HIA process. They weren't able to link the evidence, within the HIA to planning, to outcomes, because some of the evidence in literature is so high level that you can't say, well, by doing that, you will achieve health outcomes. motivating stakeholders to be engaged with the HIAs and helping develop the evidence base, identifying planning interventions in HIA. So yeah, you found a health impact as a result of development. So what are you advocating? Are you advocating active transportation, healthy food access? What are you looking for? They found it very hard to identify the exact interventions to look for in the development. And then knowing how to monitor success of HI recommendations. Actually, if you look at the HI stages, the monitoring one is actually that's not done at all by most HIA, people who receive the HIAs. How do you monitor the HI implementation? Is it done by the public authority? Is it done by the developer? And who funds the evaluation? I think that's something that's very, very poorly done. And I do find there's actually very little literature around evaluation of HI has been done. And then some of the training needs for planners, I think they want to be able to justify the need for HIAs given the lack of regulatory mandate. And I think that's the case for most countries. On data collection for HIAs and how to identify public health priorities. For health practitioners, those in the public health departments, how to help to identify high impact planning interventions, how to work more closely together with the planners, and how to justify budgets for an HIA. And that's both for the cost implications of an HIA, but also about resourcing, reviewing quality assurance. And for those actually doing the HIAs on a day-to-day basis in the private sector, again, identifying planning interventions and how to, apply the robust methodologies in HIAs. And another thing to add there is many practitioners identify variety of approaches by different public authorities. So in the absence of a single preferred HIA methodology here in England, each local authority here are creating their own HI process, if you like. And so that makes it very hard for practitioners to figure out what is the best way. Are they being policy compliant with a bad HI process, or do they follow good practice? But then actually they may not be policy compliant. So another challenge there by the practitioners around the HIAs. And then kind of finally looking at competencies, something that we worked on, and I wasn't involved in this. I know a working group by an institute here in the last 2 years. They're working on the competencies that have been required of an HIA practitioner or an HIA consultant. Currently, there's no formal requirement to demonstrate you're a competent HIA practitioner and expert. And actually, if you look at a lot of the HIAs done across wherever it may be, you may see a name on the cover or on the back cover of a person who did the HIAs, but you have no idea who they are. They could be a graduate planner, it could be a graduate heritage consultant. They have nothing to do with public health, but have done the HIA. So that may lead to a poor quality and effective HIA. And so the IEMA, and now they call ISEP, the Institute of Sustainability and Environmental Professionals, as of earlier this year, they produce guidance around what will be a competent HIA practitioner. So again, if you think that you want to be a competent HIA practitioner, have a look at the guidance there, whether you believe and you think that is something that you can achieve within your current work, or whether university can get involved in upskilling practitioners. Again, I think one thing to kind of finish on the competency routes, I think what you could do, in addition to following this guidance by ISEP, is in your policy guidance for HIAs, is you can specify, well, we'll need you to demonstrate when you submit the HIA, the qualifications of the person doing the HIA, who have done the HIA. So clearly you can say, we need someone who have done the HIA to have met the ISEP criteria, or have done a master in public health, or have done a MSc in planning with a health components in there. Therefore, we can at least see who the person may be who have done the HIA, has some skill and knowledge on doing a proper HIA than just anyone else who didn't do an HIA. And so actually, I don't feel the requirements of an HI practitioner. So something that may be addressed through training or further training for myself. So final slide here is to kind of give you some my reflections on the HIAs. I think the HIA is part of a system. And I think if you think about an HIA as part of a whole system and the health and all policies approach, that makes it a lot more effective than just as a standalone tool and lever. It is obviously very unique and distinctive from any other assessments. It's qualitative, it can be quantitative, it's participatory. It's not just something that you look at in front of your computer screens and a thing come out at the end that says it's healthy or not healthy. So therefore, it's quite a unique process in the planning system of assessment. There may not be a regulatory requirement for HIs in your jurisdiction, but there may be enough other hooks or duties that you may be required to adhere to that you can say, well, an HI can help me do that. And while HIs generally is perceived as a burden by planning authorities and developers, they do want to maximize value of their developments. They do want to see good, healthy communities, and therefore some do see an HIA as helping them be policy compliant, but also help drive value in their developments. There's for no clear national direction on HIs, at least for England, and I think most nations are the same, may lead to greater diversity and quality of HIAs without any kind of oversight. So therefore, have a look at lessons from Wales, where they have a Wales HI support unit, Scotland, where they have a HI support unit, where they can have oversight and national support for HIAs, because you do want to have that support where they don't exist currently. Fifthly, understand your role in the HI ecosystem, because you are part of the HI system. You don't need to become the whole of the HI process, but actually, if you know your role in the system, whether it be screening, scoping, or reviewing, then actually that makes everyone's job a lot easier, a lot less stressful. And then finally, learn lessons from good practices, particularly those areas that have taken a whole system approach to health and policies. Like I said earlier, many councils that have taken the HIAP approach and using HI to deliver the HIAP is where you see maximum value for HIAs. Thank you for your time, and that's my presentation. I do have some further information in my final slide, but you can have a look at it afterwards. Thank you, Sandra.
Thank you so much, Michael. That was really great. I learned a lot, and especially in thinking of, and I'll take moderator's privilege for the first question, but in thinking about like normally in the US, right, like evaluation of your HIA process and effectiveness should theoretically be part of monitoring and evaluation. A lot of times, as you noted, there's not enough money to do that at the end of the process. Have you found, you talked about having developers pay for that. Have you found that there's a steady way or a predictable way to get funding for evaluating and QCing your HIA?
I mean, I'll be interested in those in the call who if they have experience in that. I think the challenging thing about an HIA is that, at least for a project, the developer is in charge of the HIA. So they do the assessments and they submit it because they are required to do so. And they think monitoring is something that's just there. And they ask a question, oh, okay, we put in monitoring indicators here. Do we pay for that, or do you, public authority, pay for that? I don't think it's a clear answer, because developers are not going to be paying for evaluation because not on site for very long. They may be just building and leaving, and the public authority don't want to be put, they don't want to be burdened with a cost of evaluating something that that's not their land. They're just giving planning permission for it. So I really don't know. There's certainly a gap in research and evaluation around the monitoring stage, and I really don't know how best to address that, apart from maybe someone in the national agency saying we will figure out how many HIs have been done, and then we can see how we can fund the monitoring evaluation of that. Or if you're a public health department, you can say we'll fund evaluation as part of looking at our health of our communities. But I don't know. Yeah, it's quite a hard question to figure out.
Yeah, I just didn't know if there was different, like I have the same experience as you. It's very frustrating, right? Trying to figure out like who's going to pay for it, where those documents are going to live, right? So that they're public facing, and so that the public is getting like a dashboard of what's happened as a result of the HIA. And I just haven't seen a good example.
No, I think in England, we used to have what we call the HI Gateway. This was funded centrally by the Department of Health a few years ago. I think it was closed in 2015 for some reason, and there was a repository of HIAs completed. But actually, I think if you look at HIAs, you have to think about what is the HIA for. If it's HIA of a policy of a plan, generally speaking, the HIA is the public domain. But actually, most of the HIAs of projects are not are public documents, but they're not searchable because they're part of the consent application documentation. So you have to go to the consent website of the local authority, find the sites that you want to look for, look through the hundreds of documentation submitted as part of the consent application, and then find the HIA. You can't just search for it. And so there's a good case for who collects all the HIAs, should it be the public health department of their local authority collecting all the HIAs? In my research, I mentioned earlier, about a third of the councils here in the UK, in England, only have an HI policy. A lot less than a third of those councils have an indicator monitoring how many HIs they receive in 1 year. So if you ask a public authority, well, how many HIs do you receive in 1 year? They wouldn't give you an answer because they don't know. So just even basic monitoring of or counting of how many HIs received is non-existent here. So I think at least most authorities, if you're in the core, you're creating an HI policy or you're looking at monitoring evaluation, at least just say, at least we'll count how many and store how many HIs we have in 1 year. So at the end of each financial year, you say, well, in this year we received 20 HIs. Here they are in the folder. If you want to do evaluation, it's all here, but now it doesn't exist like that.
We tried for a long time in the US to have a portal, and it lived at the Health Impact Project, where if you did an HIA, you were encouraged to put your HIA up there and make it public. There's about 400 in there. And when they transitioned their data over to Community Commons, I think people just don't know where it is anymore. No new HIAs have been put up in several years. And so going back and looking at HIAs from, 2011 to 2018, it's right, like it doesn't really inform how we're doing HIAs now. Right. And that's the problem of even with, if you had the historic ones, what would it tell you about what we're doing now?
Exactly. I think it'd be quite useful exercise to kind of go back to an HI done on a development, say 10 years ago, and go to that community and say, okay, has the HIA actually made an impact? And we just don't know at this point in time.
Yeah, no one wants to fund that, right? Like that would be useful, but I'm not sure that there's a funding source anywhere to look at that.
No.
I'm not, yeah, it's depressing, but I'm not seeing questions in the chat. Folks, if you have questions, like I sit here and ask questions all day, I have 12 of them, but I really like to hear from you. We did see some appreciation in the chat. Raquel and Marcus particularly liked it. Other folks, other questions? Oh, here's Jimmy. Hi, Jimmy.
I'll always ask something if others are still thinking. Michael, it was a really interesting presentation. I hate that I was splitting attention and might have missed when you talked a little bit about this, but as it's more institutionalized in the UK and is baked into the process, and it sounds like it is more about making sure that projects and things that are happening are going to be healthier than they would be otherwise. And I think in the US, a lot of HIAs get used for advocacy. And a default perspective of a lot of folks is, well, we're going to do an HIA to stop this thing from happening. Can you talk a little bit about instances where that does happen in the UK? Like, does an HIA ever halt a project, or is an HIA so ingrained in the process that it's really about making it better and it's kind of past the yes-no decision? It's about the details and how they play out. I'm just curious your perspective on that.
Yeah, I think the misconception there is an HIA is done by the public authority or someone else other than the developer. And actually the HIA, in most cases, I would say 90% will be done by the developer to support the application. You'll find it very hard for a community group to fund their own HIAs to oppose a development. Obviously, there's a cost implication there. So a lot of the times they will possibly comment on the development proposal, which will include the HIA. By the time they comment on the HIAs, it's already too late. They've done the HIAs and it's already informed the development. So, but there are situations where at least not for the kind of mainstream urban developments, for quite controversial developments. And again, I wasn't completely involved in some of these projects, like for shale gas extraction, where a public authority may fund an HIA to figure out the health impacts of something that's quite new or quite controversial. And actually, for some of the bigger developments where they do in a standalone HIA, the nature of undertaking the HIA is very participatory. So therefore, they engage the communities in the process. And that's why I said earlier that HIA is actually a process than just an assessment, because in some ways, you can use the HIA as advocate for a development or advocate for something that's quite positive rather than just something for stopping a development. I actually never come across an HIA that's been used to stop something like that. There may be other ways to stop a development, but not for the use of an HIA, just because the cost of commissioning an HIA will probably put most communities off because they have to pay for it on their own.
Thanks for that.
Thank you, Jimmy.
I'm sorry, I went all dark again. Yeah, I was really hoping, I think, is a big difference in practice and just sort of where that process sits in within other processes. So appreciate that comment. Thank you.
I don't know, Sandra, whether it's Richard's question that you can possibly help with that, because that's about looking at data and things like that. Whether you can answer that question, Sandra. I think you're on mute. You're on mute, Sandra.
Thank you. I was gonna read Richard's question. Can you say more about measuring existing disparities in community health outcomes and health determinants, and what it may take to forecast the disparity exacerbating or mitigating value of the project plan or program?
I mean, maybe for those who are doing the HIAs, I don't do the HIAs. I can't advise on that question. I don't know whether Sandra, is anything that you could say on that question?
Yeah, I think we don't know degree, right? Like we can look at severity of impact, but I don't know that we can really and truly say it was this much health promoting or it was this much health mitigating. Like, I don't know that the science is there yet, honestly, Dr. Gelb. Would you agree with that, Jimmy? You've been doing this as long as I have.
Come on. Yeah, I think it's the rare case where you have enough detailed data to get there, and often and I think that's a challenge in the US, is we keep it a little vague for a variety of reasons, but one of the costs of doing that is then you can't look back at it in as much detail, I think.
Yeah, let's see. We do have a couple more questions, but I also see that we only have 2 minutes. So I'm going to read Cheryl's because I think it's a shorter question, not to shortchange you, Raquel. But Cheryl's question is, she'd like to ask if you could talk a little bit about the training. It looks like, oh, you're on a train. I'm sorry. Can you see the question? Stakeholder engagement.
Yeah. Well, I think that's the issue, because there's so much emphasis on rapid HIAs or desktop HIAs, and a lot of the guidance that I see on HIAs here in England that I think people see it as just a checklist to kind of go through. And I think that's potentially people not understanding that the HIA is a process, and that includes engagement with both experts and communities and stakeholders. And so I saw an HIA draft guidance recently, and there was nothing to say, well, you complete this checklist, complete this matrix, and that's the HIA done. There's nothing about engaging communities, engaging whoever they may be. So actually, I think it's about awareness raising. It's an HIA is actually a process, not just assessment. One final thing to add is, I think in terms of stakeholder engagement, there was a situation a few years ago where we were asked by the public health team who said they were approached by a developer who were doing an HIA, and they wanted public health data, whether they can provide it to them. And the dilemma there is that in doing the HIAs, obviously they did a supported development, and they've gone to the public authority health team to ask for data to support the development. And so by providing public health data to the developer for the HIA to support the developments, they in a way possibly undermining the decision at the end, where the planners may say, well, actually, this development is bad in general, but then the public health team, or the public health team would have provided them with data to say it's actually quite good development. So I think clarifying stakeholder engagement elements on HI is really quite important, and really not relying on just the desktop rapid HIA as the default position. It was a complex HIA or complex scheme, then obviously you need engagement, and I think that should be featured in any guidance on HIs by public authorities.
I agree. And I'm not sure that it always is, right? Like, especially a desktop or a rapid, people are like, well, I didn't even talk to anybody. I just did this, right? And you can't, even though you don't have money to engage with the community broadly, you still need to be engaging. Thank you so much, Michael. I'm so sorry we didn't have time for the other questions, folks, but please, you can email Michael. His contact information is on the slide deck, which we'll be sharing, and we'll also be sharing the recording. Thank you so much for joining us. And if you're not already a member of SOPHIA, please join us at hiasociety.org. Thanks so much, everyone.
Thank you, Sandra. Thank you, everyone. Thank you.
Bye.